Welcome to a special edition of Diabetes Connections. As you know, my background is in TV and radio news. And for a long time, I've wanted to do an episode like we're about to try to do here, sort of maybe a meet the press or a front line where we can just talk about news and events in the diabetes community. So we're here on this interesting platform. This is the second time I've used Blab, which I think should really be called Brady Bunch, talking to each other, because I love these boxes. But we're going to be talking about access today and the recent decision from UnitedHealthCare to choose Medtronic as a preferred pump provider, what that means, and the bigger access, maybe dial it back a little bit to the bigger issue of access. So first, let me welcome my guests today. We have Christel Aprigliano and Mike Hoskins and Gary Scheiner. And I'm so thrilled that you could all make time and learn this system to be with me today. You may know these folks. Christel is the founder of the Diabetes Unconference and vice president of Diabetes Patient Advocacy Coalition, or DPAC, a nonpartisan nonprofit organization that seeks to keep diabetes issues in the forefront of policymakers in the U.S. And she's a member of the Diabetes Advisory Council for the state of Florida, appointed by the governor. Mike Hoskins is a journalist and the managing editor of DiabetesMine. And Mike recently shared that this Medtronic and UnitedHealthCare decision became very personal for him, and we'll talk about that as well. And Gary Scheiner is the owner of Integrated Diabetes Services, named 2014 Diabetes Educator of the Year by the American Association of Diabetes Educators. He has authored 6 books and recently wrote a column about why pumps are not a commodity, all about this issue of access. And all 3 of my guests live with type 1 diabetes themselves. I do not. I am a mom of a child with type 1 diabetes, but this is an issue that affects everybody. All right, I've talked enough. Thank you all so much for joining me.
Thanks for inviting us.
This is going to be
Thank you, Stacey.
Now, on Blab, people have the opportunity to join us via Twitter, and they may ask questions or perhaps chime in with some statements. So we'll try to get to that a little bit later on. But Christel, let me just start with you. When you heard about this action here, and this is an agreement between 2 big companies and affects a lot of people, what were your first thoughts?
So I think what I should, that's fine. So I think I should start by saying I don't currently use UnitedHealthCare, and I don't currently use Medtronic, but I have been a member of UHC in the past, and I was a very loyal Medtronic user, and I still think that Medtronic is a good company. It is unfortunate that this becomes an issue of choice and access. And so when I heard about this, my fear is that if this continues, what we'll find is that the next insurance company decides to choose one pump supplier, and without giving individuals access to the opportunity. I think I was a little concerned because it is you have one choice. So not even an option to use another pump at a higher rate, even though it's not optimum, it still gives individuals access to the devices that physicians and healthcare providers prescribe. Because as we all know, everybody's diabetes is different. So what works for me may not work for somebody else.
And Gary, let me ask you to chime in, because you work with patients on this kind of thing all the time. Why is this different, or is it perhaps from a company saying, which they do all the time, we don't want you to use Novolog, you have to use Humalog, or that sort of thing?
I think the difference we're dealing with here is that insulins, in many cases, are interchangeable. I mean, there's maybe very subtle differences in the preservative or the mixture, but the insulins tend to work about the same. There are some people who develop allergies, in which case they can usually override the insurance company's order. But the insulin pumps have a lot of differences. You know, it's true they deliver basal and bolus, but there are a lot of differences that make them more usable for certain people and safer for certain people. And when you asked Christel the question about what was your first impression when you heard this, my first impression was I wanted to know what were their motivations. Yeah. Because you got two very large companies. Both companies are in it to make money, even though I think UnitedHealthCare technically is a nonprofit. They're trying to maximize their revenue and reduce their costs. So my initial impression was, Medtronic must have undercut everybody else, and that's how they did this. Because when I look at the product itself, their sensor and their pump link has something unique to it, but so few people use Medtronic sensor that I couldn't envision that would be the reason. So I thought initially it's got to be a price thing. Yeah. They just outbid everybody else by so much that UnitedHealthCare decided we're going to save a small fortune and just.
Gary, I'm going to interrupt you just a second if I could.
But then
Gary, can you hear me?
Talk to some people.
I'm really sorry. We're getting a little bit of feedback from your headphones. If you could maybe move the mic just a little further from your mouth. Does it adjust that way? Just a little further. Give that a try and see if that helps. We'll find out.
Yeah. How's that?
I think it's a little bit better, but what you're saying is great. We can make out like 95%, so go right ahead.
Mm-hmm. Oh, sorry about that. I talked to a few people who work in the DME distributorship industry, and they said Medtronic is not a company that reduces its prices for anybody. So I really wonder if that was the case, or if UnitedHealthCare just made a medical decision thinking that it was truly a better product for its customers. Still, I really wonder what the motivations were, because there are a lot of reasons that certain pumps just don't work well for certain people. And the people at UnitedHealthCare made a decision without really knowing the facts. I believe whoever their in-house medical people are that approved this or initiated it, for that matter, just don't know pump therapy
and Gary,
well enough to make this
audio
kind
quality
of a
was
decision.
much better, so thank you very much for adjusting that. It is amazing to think about why, if it's not money, I think we all assumed that. Mike, let me ask you, and if you wouldn't mind sharing, you made a personal decision because of this, but what was your reaction when you heard about the deal?
About the same as Christel and Gary. I was concerned. I wanted to know, first of all, the actual story and the truth of it, because so often we hear, initially that something is not covered when there's a story beyond that of, well, it is covered. You have to put up a little more of a fight. And I wanted to make sure that I knew all of the full scope of what the story was. And again, I think, what are the motivations, the personal choice of the whole matter. I think that, pumps are a little bit different in that you have a lot more interaction than you do with most other devices, maybe not CGM specifically, but I think that's kind of the ripple effect of where this goes from there is what happens next beyond insulin pumps. But I think we're talking about the highest cost item beyond insulin, beyond meters, where this is a personal decision that people make on what device, and it's bigger than the insulin. It's bigger than the meter that they use. And even if you... Go ahead. I'm sorry.
No. I didn't mean to cut you off. Go ahead. Even if you...
Well, and I was going to say, even, in this particular case, even if you still have a choice, you have to go through higher prior authorizations or, fight a battle, and hopefully your doctor or your care team is able and willing to do that for you. There's a lot of people who are not going to have that option. Their care team will just not want to make that fight, or they don't know that they can actually make the fight, and it's not worth their time and their energy. So they'll go with a Medtronic pump when they don't know what else they have access to, and they lose out better care as a result of it.
I see a lot of nodding.
Mike, I like when you mentioned the meter as another product that above and beyond about the personal involvement. And for the most part, the later model meters, they're all similar in terms of accuracy, in terms of how much blood they require, the speed, and so on. But a lot of times now, health plans are also looking at meters as commodities, and they are looking to provide much lower price meters, which aren't as accurate as the more current meters. And I'll throw names out there. The One Touch Ultra system, Ultra meters, for a long time, state of the art, but not anymore. the accuracy is not nearly as good as we see with the later model meters. And for people who are basing insulin decisions, dosage decisions on the accuracy of that meter and calibrating their CGM based on that meter, they need the more current equipment. They need something that's more precise. And it's a very similar analogy with the pumps. If there is something that's better for that individual and their insurance is restricting access to it, and apparently not for a financial reason, that's just bad. That's poor health. That's poor service from a health insurer to do something like that.
But Christel, when we have bad service from a car dealership or the grocery store, we know who to go to, and we can say, give me a refund or I want something else. This seems so difficult to navigate for the average person. It's hard to get your stuff in the mail half the time. I mean, what you are with DPAC, obviously, you guys are trying to push through a lot of change here. What can we do? And where do you see this going? Two separate questions. Sorry.
So yeah, I'm just like, wait a minute. So just so, for the Diabetes Patient Advocacy Coalition, we are entirely based on three things: safety, quality, and access. And when we look at this sort of decisions that are being made by insurance companies and not by between the patient and the providers, and I hate to use the word providers because there's so much more than that, they're your healthcare team. These are decisions that are made that are based on a number of factors. And so when I go to an expert, a specialist, somebody like Gary, and I say, this is my current situation. This is what I need. I want to have better care. I want to make sure that I'm safe. We look at all of this, and to be able to be denied the ability to have safe, accurate, quality devices that our physicians, our medical professionals prescribe to us because that's what's going to help us live longer and healthier. It's not really just an issue of, you're right. I mean, with Gary, it's not a commodity anymore. This is something that we have to function with every day. This thing lives on me 24/7. I use meters that will help. And in case I want to have ultimate access, it's going to cost me, right? So that for me is worth the fight. And I have the good fortune of knowing how to get to where I need to go, whether it's appeals or prior auths or having to get overrides. But for everybody else, for the majority of us, we probably won't go through that. And I know, Mike's had issues, and other individuals have had issues just getting what they thought that they could get in terms of good care. So for us, this is not a sprint, it's a marathon. I know that we're not going to be changing this overnight. We ask individuals, patients, providers, anybody that is impacted by people who find that there's a struggle, to go to diabetespac.org/access-matters and share that story. So we've created a repository of stories at DPAC, at diabetespac.org, and these are available to everybody. It's not just diabetespac.org's stories. These are our community stories. And so as we gather these stories and share with our policymakers to say, look, we understand that we live in a capitalist system. That's not an issue. That's not going to change. But what we'd like to have the expertise of our medical professionals be the deciding factor on what our choices are to get access, not based off of actuarial numbers, not based off of what may be best in terms of the 80%, but for the 100%.
And Mike, let's lead to that. You publicly said you stopped using Medtronic recently. Was that all about this?
Not all about this. It was a final straw. I should say that I don't have UnitedHealthCare like Christel. I've had it in the past, but I've got very good insurance, and I have multiple pump choice options at this point. And I've been a long-time Medtronic guy. Started with MiniMed way back in the day, and it's the best pump for me. I went through all the options. I looked at all of them and made that decision. And over time, I've been less happy with some of the business decisions I've seen Medtronic make. And I realize in saying all this that, I'm fortunate that I can make the choice to go onto a different pump or not to pump at all, which is what I'm doing now. I'm taking a break. And that's something I needed to do for a while. I mean, for months I've been saying I need to go off my pump and, just go back to MDI and see how it goes and get myself back on track. And then this whole issue happened, and I took some time and I thought about it, and I said, I can write about it, I can gripe, I can voice my concerns, but you know what? I've got the power as a customer to say, I love your device and it is the best choice for me, but it may not be for everyone, and I don't think you have the right to dictate that because you're the big player in the market. And I don't like how Medtronic specifically says, oh, well, this is the game and this is how everything is going. And insulin makers do the same thing when we talk about high insulin cost of it's all the primary, it's all the PBMs and the insurance companies making these decisions. And we're just the innocent victims in this when they're the one pulling the strings. They're approaching this and having these conversations. And if they have to play the game, so be it. But I want them representing me as a customer, as a patient, saying, we'll play because you're forcing us to, but we don't like this. And we want you to do something about it and make sure that all of these other companies and all of these patients have access to what they choose is the best. And if that's us, we'll prove it. We're the best. We think we're the best. But let's make them decide.
Gary, I see you nodding. Oh, go ahead.
Yeah.
Well, I hear what Mike is saying every day, and it's not just from people with diabetes. It's also healthcare providers who have become frustrated with Medtronic as a company because of their business practices, not the product necessarily. Although there are issues with the product too, but because of a lot of their business practices. Ultimately, Christel, what you're saying. It's all, I agree with you completely. When you talk to a health insurer, they're not going to be as sympathetic to patients because of their emotional needs. They're going to be interested more in some more hard data. What difference does it really make if we offer someone a Medtronic pump for $6,000 or a Tandem or an Animas or even an Omnipod, which wasn't included in this arrangement, but to them, they're going to want to know.
At this point, right?
You're right, because this is an unholy seed that must not be allowed to grow. Because it is going to spread to other product lines and it is going to spread to other insurance companies if it's successful.
But wait, so what do you define success? Because if it's not about money, that's what I really thought we were all going to be talking about. What's the success here? Ease of paperwork?
Well, I think Medtronic sold them a bill of goods. This is just my own gut instinct that they showed them data about people who used the 530G with the threshold suspend, and that because the Medtronic pump offers this level of safety, that UnitedHealthCare jumped on it. However, there's a strong contingency here that people have to use the Medtronic sensor for this to work. And I think the vast majority of the industry knows that their sensor comes in a distant second to Dexcom on many levels. So that's one of the areas where I think UnitedHealthCare didn't really understand what they were doing. They figured, they get the Medtronic pump, they'll use their sensor, everyone's happy. But 9 out of 10 people, at least from my experience, who go on the Medtronic sensor, go off the Medtronic sensor, either don't use anything or get on a Dexcom. So that's going to be an ongoing issue. They're not going to see the kind of benefit they were hoping for. And I got an email this morning from a woman who saw my article about the differences between the pumps that have significance from a clinical and safety standpoint. I had 16 reasons that pumps aren't commodities, things that are unique that affect a person's ability to either use them safely or use them effectively. And there was one she sent me that I hadn't thought of, and that was finger strength, hand strength. She has a hard time pressing the buttons on certain pumps and had to go with a touch screen because she just has severe arthritis and wasn't able to physically press the buttons on some of the pumps. So, that's another reason. And there was another one somebody sent me was about the reminder alerts. Not all pumps have reminders for things like site changes or for missed boluses or for doing blood sugar checks. So, I think it was for their teenage kid who forgets everything. So they needed those reminders in the pump. So I'm up to 18 items now of reasons pumps are unique.
And we're going to link everything at the podcast at diabetes-connections.com. We'll link the column and different things that we've talked about, Mike's writings and Christel as well. But it is when we think about using an insulin pump, it's not like many other medical devices. We talked about that in terms of it's with you 24/7, and it's not a commodity, as you said. Christel, we kind of lost our pacing there, but let me get back in on. I'm curious. I think there is a feeling almost not among the people I'm speaking with today, but among some, and I'll put myself in this category. Sometimes we just feel like there is nothing we can do. It's hard enough. Oh, yeah. Well, you're going to tell us. But it's so hard to just call and get the stuff that I need every quarter for my son. And sometimes I have to hang up and call back and ask for somebody else. Mm-hmm. What can we realistically do about something like this and the bigger picture?
So about a year and a half ago, I had a problem with my particular insurance company, which ironically enough at the time happened to be UnitedHealthCare. And so it wasn't about diabetes. It was about something completely different. And I was so frustrated by the problems that I encountered that I wrote a blog post about it on my personal blog, theperfectd.com, which I will get you the link at the end of this so that you can go ahead and link it. But I think it's important, first of all, to be able to know what your healthcare policy provides you and the ins and outs. And so, I joke that sometimes you need a master's degree in insurance in order to sometimes figure out what's on a formulary, what's not, the process of applying for a particular device and all of the documentation that you may need to provide. This is different for every single healthcare plan. And so what I found was that all of the hours that I spent online and on the phone trying to get all of the documentation, it is an amazing thing to use your state's insurance commissioner. And so I had continuing problems trying to get things solved. So I filed a formal complaint with my insurance commissioner in my state. And it is amazing to find how quickly my issue got resolved and I didn't know about it before, right? So my issue was resolved in about 30 days because that's the legal requirement for my state to get a response and a conclusion. And so I'm going to suggest that if individuals are having issues that, and if your policy says that you are able to get these supplies, that you are able to get overrides or whatever, that you file a complaint with your insurance commissioner in your state. That's sort of the nuclear option, but I'm kind of thinking that maybe we need a couple of nuclear bombs going off to raise some awareness. Now, that's not going to do much in terms of what's going to happen in July with UnitedHealthCare and their exclusive contract with, or almost exclusive contract with Medtronic. But I think it does raise awareness that we're not going to be quiet, and that as a community, that the more that we share these stories, the more that we talk about the fact that we need access to multiple different types of devices and medications and services as well, that we will slowly make change. And if you can do it on a personal level, that's great, and then share your story. It just becomes a little bit louder as we go along.
Mike, have you heard from Medtronic or from anybody that you'd like to talk about?
Not officially, no. They've been pretty much in silent mode, since those first couple of days, responding with general PR statements and things. yeah, I mean, I had a local JDRF event this past weekend where Dr. Fran Kaufman was actually one of the keynote speakers, and outstanding, great woman who does so many incredible things. And she had, of course, she touched on this briefly in her keynote without specifically saying, UnitedHealthCare, but talked a little bit about what Medtronic is doing studies, obviously, with its devices relative to what payers and FDA wants to see. And then we had a conversation for a little while afterwards where she talked a little more, one-on-one openly about this. And, it doesn't really change. I mean, she understands the frustration, and, she I think, is relaying that as we communicate with her.
And I'm sorry, Mike, I'm not familiar with who that is. Is she affiliated with these companies?
She is. She is a really well-respected endo who, I don't even know how long she is now the chief medical officer for Medtronic.
Okay.
She's the medical director for Medtronic.
Medical director, thank you. Yeah.
Okay. So speaking at a big public event, but not really, kind of talking around it.
Right. And, and again, understandably, she's not on the business side of this, but she is an executive within Medtronic Diabetes, so she kind of, she's wearing that hat, even though it's really not, something she's created. And she understands. She understands the frustration, and, I relayed to her, personally, just what I've been hearing from others in the community, and, my own, mindset is, I want Medtronic to hear these concerns, and I want them to respond to all of us and say something beyond just press releases. And
so can I also just
has not happened yet.
Yeah, go ahead.
I want to jump in here, and I want to kind of bring this out of the laser focus on the issue between UHC and Medtronic, or the issue of. This is a wider issue. This just doesn't happen at UnitedHealthCare. We've had individuals say, my particular healthcare will only allow me to get one type of pump. So this is not just Medtronic. There's another pump company that has an agreement with a smaller healthcare plan. And the mindset of it's between the healthcare plan and Medtronic comes to a wider thing. It's a formulary. It's an access issue. If I can only get one type of medication versus the other type of medication, or if I am denied access to medication, or in a particular case right now, if you are 65 years or older, if you have been on a continuous glucose monitor, once you are on Medicare, which is a health insurance plan, technically, you no longer have access to that. So this is a bigger issue. And so for me, when I look at this, I see this as the first time that our community has started to make noise. And we need to continue to make noise to say we need access to the devices that are going to keep us healthy.
Here.
Yeah.
In my mind, the only thing that is going to keep this unholy seed from flourishing is if it turns into a public relations nightmare for both parties.
But Gary, talk to me about that, because how do we do that as a community? I know when Christel were talking about gathering stories, it's so hard to fight this sometimes that people just say, oh, I'll go to Medtronic, or I'll take a pump break, as Mike said. If we want to do some kind of public relations nightmare, what do we do? Keep talking about it like this? Have patients changed or try to change pumps? What are you talking to your patients about?
I think Christel might be in a better position to offer some help with that. I can just tell you, any patients we have with UnitedHealthCare, we're going to, if Medtronic's not the pump for them, we're just going to encourage them to go through their appeals. I'm sure they'll have an appeals process, and it costs them money every time people go through the appeals process. So if the tens of thousands of people are appealing to get a different pump, eventually they're going to realize they made a mistake and they're going to have to go back.
And as an educator, you can kind of encourage them and help them with those appeals, I would imagine, because that's the first person I would call, because I wouldn't know how to do that at all. Do you help people with that, Gary?
Yeah, I mean, we'd basically let them know they have to, like Christel said, they have to know what their policy allows them. And often, you can read through a manual, but it's really best to call up the health plan talk with a case manager and find out what are my options, what are my rights, because they're required to give you that information. They're not going to hide it from you. And it's kind of like with Medicare, even with the CGM, if you go through the appeals process, you do have a chance of reversing CMS's original decision about denial. And the same thing will be true. I haven't seen the specifics about how UnitedHealthCare is going to handle appeals, but apparently they will. They will if there is a medical reason, and there are a lot of medical reasons for choosing a pump other than Medtronic, and hopefully those who benefit from a different pump will follow through. To me, the squeaky wheel gets the grease, and if there are 100,000 squeaky wheels, UnitedHealthCare is not going to be able to withstand that.
And I think that the important thing out of that is exactly what Gary does. Gary works with his patients. He works in conjunction with his patients. And so as we move forward, and if you are looking to appeal, is to work with your healthcare team, because they're going to give you the scientific data that it's not just about, well, this pump is waterproof and this pump isn't, or this one has a touch screen and this one doesn't. It's the blood sugars, better quality of life, if you can quantify that. And it's important that you have this discussion with your healthcare team, because they don't want to have to go through all of these appeals. This takes time out of their schedules. This takes time out of their staff. This isn't, the access issues. I was at the Florida Diabetes Advisory Council meeting yesterday, and we had a huge discussion of access and how much time we as patients spend trying to get appeals and authorizations, and how much time it takes at a practice trying to get this done. One individual said they have hired somebody just full-time just to handle insurance appeals, prior authorizations, making sure that all the prescriptions that are being called are up to date. This is a full-time job. Wow. For many patients, for many practices, and if we have ways to make it easier, that's what we're going to do. And so, again, it's work with your healthcare team. And, the other thing, some people don't have a choice. If they are going through their employer-provided plan, and it happens to be UnitedHealthCare or another healthcare plan, they can work with their employer's HR office, because it is amazing what happens when the HR company, the HR group calls up and says, well, we're having problems with our employees not being able to get the access and the care that they need. So there's a lot of ways to get voices out there and coming from different places, whether it's from the healthcare team, whether it's from patients, whether it's from HR, from the employers. The more that we stand united in terms of how to get access, the likelihood that we will achieve this is greatened.
Wonderful. And let me start to kind of wrap things up here. I'll give you all a last word and a reference here. Mike, let me start with you. I know over at DiabetesMine, where you are the managing editor, you've got a lot of news stories on this, and you're hearing, I assume, from a lot of your readers. What has the response been like? And I'll give you a kind of a last word to wrap up your situation as well.
Yeah, I mean, I think, what Christel said. I mean, there's a lot of frustration and anger about this, and some of it is focused specifically on this issue and the two companies. Other is the broader picture. And then still, there's some people who are upset that, where are the big diabetes organizations in doing something about this right now immediately, and why are they not doing more? And I think those are kind of the few different hats we're seeing on the heels of this. And to me, that's kind of the bigger picture. When we talk about coordination and, making this a PR nightmare, I think we have to focus on those individual stories and focusing on this issue, but taking it more broadly and making this a bigger issue as we go into these big meetings, like, the educators, the endocrinologists, the medical professionals at ADA, and where these topics are discussed broadly when you've got thousands of healthcare providers and educators and patient advocates in the same place.
That's a great point. Gary, last word to you. Just keep on raising hell.
I think we have to encourage people with diabetes and their healthcare providers to be educated consumers. check out your options, see what's going to work best for you, and do what you can to make sure you get it. I think that's the only way, in a free market, that people can continue to have choice, is if they demand it. If everyone just accepts, oh, well, we're fine with that pump, then that's all you're going to get. But if you understand the differences between them, and I think healthcare providers play a major role in this. Unfortunately, most don't teach their clients and patients about the differences between systems, and the patients end up losing as a result. So choice comes from both ends, or all ends. It's the patient, their healthcare provider, and their third-party payer.
And Christel, you kind of, wrapped it up just a moment ago, but talk to me about DPAC. You mentioned this much earlier. You're collecting stories, but I think that's something very actionable people can do today.
I think that the frustration of we can't do anything. If you go to www.diabetespac.org, there are a lot of actions that you can take. And Bennett Dunlap, who is the president, and I have spent a lot of time trying to make diabetes policy advocacy easy. And so we joke that we're the easy button for policy advocacy. You can go to the website and you can add your story. You can read the stories that have already been collected. You can take actions. We will be working on this, and we are working with other organizations as well to ensure that the issue of access does take place. And if you haven't already gone to the DPAC website, you can send a message to your policymakers, and that's your representatives and your senators in Congress about the CGM issue, which has gathered steam, and we're really hoping that we have enough in the House of Representatives and the Senate, if not this year, for very early next year, to have the CGM Medicare Act of 2015 passed. So that's one way that you can channel your anger into action. And I think that it's important to also remember that this is not going to go away. The hullabaloo of what's happened over the last 2 weeks may start to quiet down. But Bennett says this wonderful thing: we need to be consistently engaged and not intermittently enraged. So as a community, we need to start being strategic in how we approach the public and get stuff done.
Well, thank you all so much for joining me today. A few technical glitches here and there, but a wonderful message and really great information. So Gary and Christel and Mike, thanks for spending some time with me, and I'd love to have you back on. Maybe we can make a regular panel out of this. I love it. Thank you.
Thank you so much, Stacey.
Thanks for having us.